go. Dr. Zymantas, let's talk about gum disease. Almost all dentists I know, when a person has gum disease, they keep saying, look, you got to fix it, otherwise you're going to lose your teeth. And while this is very true, and while losing the teeth is not a good thing because, well, it's expensive to fix them, and all kinds of other things, and unpleasant and all that stuff, but at the very least, you dentists can fix them. What I, however, look at, and tell me whether how far off I am with that. When you have gum disease, it takes a year, 2, 3, or whatever many years it takes to start losing bones and the teeth. During that time, you poison your body because you have an infection in your mouth, which is at the gateway of the blood vessels in the mouth, and which goes into your blood, poisons the liver, poisons the kidney, poisons the heart, poisons the blood vessels, and all kinds of other things. Tons of body problems can and will happening like any other infection. Is there some truth to that? It looks to me that that's a much bigger problem than losing your teeth, because at least if you have money and willing to fix it, you can fix them. But you can't fix those other problems anymore, which ruined your overall health in the meantime.
Absolutely. What you may be specifically talking about is a factor that is made by your liver because of your infection in your mouth, called C-reactive proteins. And these C-reactive proteins go throughout your whole system and create low-grade deterioration of pretty much every system in your body. In your brain, it will increase the amount of plaque buildup on your arteries. It will increase the amount of atherosclerotic plaque because it is an inflammatory marker. When presently I have read, I haven't really discussed it with too many people, but I have read, and I believe that there are some high the ability to gather the information for the C-reactive proteins in your body with high specificity. There is a test out there now that they're looking at, that it is a better marker for potential heart problems like heart attack or stroke because of a
better marker than cholesterol, I guess.
Yes, it's a better marker than looking at cholesterol levels, because the C-reactive proteins are just so much more damaging and such a incredibly visible aspect when you do a blood test, better than a cholesterol study.
Right. So, but to get, this is wonderful information. So you agree, I think that's what I'm hearing, that yes, having an infection in the gum poisons your blood and brings, for instance, there is ladies who are pregnant could and have been proven to have premature births with underweight babies because of an infection in the mouth called gum disease. True?
This is correct, and there's actually been at least one case of a woman who was delivered a baby to term. Full term, it was a stillbirth, and they determined that the baby died from a stillbirth because of the severe periodontal infection in the woman's mouth. There was just such a high amount of bacteria and bacterial activity that kind of, for the most part, poisoned her whole system. And that's happening to anybody who has periodontal disease now. And in most cases, it's a slow degradation of many systems. So especially now coming up with the flu season and the cold and flu season, many people, their immune system is being kind of like knocked down. There's too many factors of your body trying to fight off these infections, and it doesn't have the strength to fight all the infections. So people are more prone to develop colds and flus again in this flu season. But there's even links to some pancreatic cancers, say, and increased level of diabetes and hypertension. So, right. It's just like a slow degradation. You don't really feel it happening. It's kind of like watching your hair grow. You can't watch it grow but it's slowly being affected, and it is affecting your body.
Right. Well, and if it can do something so severe like a stillborn baby, an underweight baby, pancreatic cancer, or like the guy in Japan who researched that HIV could possibly turn into AIDS much easier because the immune system is down. Now, most people don't have those large problems, but if you can do those things, as you said, what about the next flu season? What about the next swine flu or bird flu season? You don't want to be weak. What about just being fatigued on a daily basis? Not, wondering, why am I so tired? If all your health soldiers have to fight this infection, I mean, wouldn't a person who has a yellow, ugly reddish pus on the finger, or maybe on the whole hand, or on the toe, on the feet, called a toenail infection or whatever, everybody runs to a doctor for that, and it's a good thing. I'm not making it less of it. It's just you have a large infection, which apparently is as big as the hand in your mouth if it's a full-blown gum disease, and you're not going to a doctor. Only because apparently you don't see it, which is not totally true, because you're bleeding every day when you brush and floss.
Yeah, you're correct. There seems to be almost somewhat like an old wives' tale that it's permissible or allowable, and it's a normal thing to bleed when you brush your teeth, or if you take a toothpick and slide it underneath your gums. That's a normal thing. In reality, say again, if you, like you were saying, if you have an infection the size of the palm of your hand on your elbow or on your wrist or somewhere, you would definitely take and try to figure out what's going on rather quickly. But somehow people don't quite understand the relationship. It's getting stronger. More people are understanding that there is a link. There's still a lot of education that needs to be done, and for people to understand that there is a link, and the other part of it is that it is preventable. But one of the easiest ways a person can kind of check if they have periodontal disease, first of all, ideally you'd go to the dentist, somebody who really does treat periodontal disease. Some dentists don't really concern themselves that much with the problem. But if you just take a toothpick, a very, very slender toothpick, and you slide it in between your tooth and your gums, kind of as deep as you can go until you sort of meet resistance, and you try it in several areas around your mouth. And if you have any bleeding whatsoever, that means that you have an infection going on, because that inner lining of the tissue is ulcerated, and you're disturbing the ulcer, and that's what's causing the bleeding. So if you do a little test like that and you find yourself with a little bit of blood, it means that you've got some kind of activity going on, and your health is definitely at risk.
Well, let's cut this video short and let me get to the dentist.
Okay.
Bye-bye, Dr. Zymantas.
Take care, Mr. Flash.